Hey everybody, Lori Broccoloni here, happynaturalhorse.com, helping you help your horse stay healthy and sound and being pain free through the how to identify and release your horse's pain points on my site, happynaturalhorse.com. So today we're going to talk about this is the horse article. I was going to snipply it, but I decided to do a video on it to go over the ins and outs of what they have to say. So they are promoting, of course, platinum, which is really not a great, it's not the greatest mineral. You want more, it has a lot of synthetic and other oogie stuff in there. But here is, they're doing an article dealing with equine colic. Here are 33's do's and don'ts. First thing you do is when you suspect colic is definitely call your vet, okay? So here is the article. So is it or isn't it colic? Okay. If you can't tell what you're dealing with, there's times that there's clinical signs to do when you first signs of colic. Refers to as abdominal colic refers to as abdominal pain rather than specific disorder. Conditions that commonly cause colic include gas, impaction, grain overload, sand indigestive, and parasite infection. Stress can do it too. Any horse that has the ability to experience colic, the disorder is it just doesn't discriminate against the age, occupation, or the environment. Okay, so. Do check your horse for vital signs, and then they go to the vital signs. Check the heart rate, the temperature. Also check the horse for heat in the hooves and the rump muscles for tightness. They may reflect laminitis, tying up and respectively, which can mimic colic and abdominal pain. Do look for the presence of feces in the stall. Okay, absence of reduced amounts of manure can indicate a problem. Call your vet immediately, even with the vaguest of signs. Waiting long enough can cause major problems to become severe, and severe problems to become untreatable. Marianne DuPont in Virginia, the horse hospital out there, equine hospital out there, states that you should always learn how to help your horse while the vet is on its way. And one of them is colic. So don't wait to use C approach before talking with a veterinarian. So, especially with some forms of colic, Weatherly warms, if the horse is painful because of excess fluid in the stomach, the horse can rupture his stomach. And once that occurs, there's no treatment that will save him, and you'll have to destroy him. So do monitor your horse for long as it takes. Many people have them in conception. They can go and do errands and come back a couple hours and see if the horse is doing. You never leave a horse during colic, never. So you've got to check the horse every 15 to 20 minutes. That's number, doesn't tell you what the number is. While you wait for your veterinarian, do walk the horse if it's safe, and to stimulate the gut mobility and to prevent injury from rolling. Greater than 50% of mild colics will clear up just by walking. And then it says recommended 40 to 60 minutes. Brisk walking may exhaust the horse too much, especially if it has an impaction. Impactions are hard to remedy because they're impacted, and it's, you know, that's why they put oil, they put oil, mineral oil in there to loosen it up. And if it doesn't, then you have to either go to the hospital and have surgery, which is way too expensive in my case. And I mean, a lot of people can't afford it, and sometimes the horse recovers 50%, sometimes he doesn't. So you have to make that call. Don't feed the horse when he's colicking. You never feed a horse. And do withhold excess water. And I do agree with that a little bit. But you want to wait till the vet arrives. Do not medicate without your veterinarian's approval. Most people give Banamine, never give Bute. Most people give Banamine, and that relaxes the horse. You could also, I've gone and long time before I was natural, I would get the minerals and do the mineral before the vet arrived. And sometimes it helped and sometimes it didn't. If your horse is not responding to painkiller, it's not because you didn't do enough medication. It's because the condition is beyond the medication we could do. And that is an important thing to remember. So I think I've been around horses that didn't respond to the medication and they didn't survive because it was an impaction. So I'm going to tell you in a little bit, I will tell you in a little bit what I would do, but I want to go through these 12 ones. You don't want to administer anything through a tube or syringe, mineral oil in the horse's mouth. That's what they say. If it's done incorrectly, it could get into the lungs, but I find with a syringe, you don't have a problem. Don't administer enemas. It could tear the rectal, and I didn't know that. So do keep your horse contained in a safe area, small pasture. If you put them in a stall, they could cast, so a small area would be ideal. Do start thinking about preparing trailering for clinical signs. To borrow a trailer, get a trailer there if you can't get the vet out or if the horse needs a hospital. So do trailer without dividers just in case the horse goes down. Don't ride in the trailer, that's common sense. Okay. Don't deviate from your veterinarian's plan. Do monitor incisions if they do the colic. And they have to wear this. Hold on, let me see if I can get this over here. They do have to wear that band for a long time. I think it's like 60 days, but I'm not sure. Reducing colic risk and horse being prepared. Maintain a constant feeding protocol. Horses are herbivores, and it's best to do the Stanley Timothy hay pellets and not commercial feed. Commercial feed has nothing but crap in it, and it also creates an acid because they have to break it down, and you only can feed in small portions. I've seen people feed way, like half a pail of buckets of feed, and the horse can't really handle that. It's better to give 24/7 hay or let them on grass, okay? It's better to do smaller meals, which I agree with, than 2 large meals, okay? And you guys have the misconception, everybody has that misconception that grain creates weight. It does not. Hay and grass with the chewing and the saliva is what is, and having a pH natural gut, health in the gut, a natural pH in the gut. So if you feed a lot of grain, you're going to create ulcers because they have to create more acid to break it down. Horses like to have something in their belly with them every 2 hours, but you don't have to give them grain every 2 hours. You can just make sure they have good hay. Do forego grain over forage. See? They agree with me. They're not made to digest grain, okay? See? High grain diets are linked to increased incidence of colic as well as founder obesity and other disorders. They say they need the grain if they're losing weight, but they're losing weight for a reason. They're not digesting. That's why we use the high track from Big Sky Minerals, and that's why we use the Big Sky. The Big Sky and the high track will help with the weight loss. Do encourage drinking to reduce the risk of impaction. So make sure you have fresh water at all times, and do provide exercise. Horses need to work. They need to move. And so do take steps to reduce sand. A lot of people on the East Coast have sand. A lot of them give the psyllium for, I think it's 3 to 5 days during the month. And check your stool samples for sand. And see, psyllium products. And I think it's once a month they do that. So do consider management changes if the horse is colic before. And example, feeding or housing change. Do consider gastric ulcer prevention. So that would be keeping your horse on a natural diet, made of just Stanley Timothy hay pellets. It's the highest digestible hay pellet that you're going to find, and they don't need much of it. Grass and hay 24/7 is basically all they need, and then a good mineral supplement. So let's see here. This is my free ebook, Preventing and Relieving Equine Colic, and it's yours free when you visit my site. Either site's happynaturalhorse.com or Natural Equine Remedies. So that will pop up and you will get this Colic in Horses, Call a Vet. So this is a little short ebook. Here are tips on parasite control to help prevent colic in your horse. Okay, and it talks about the signs, you know, kicking at the belly, biting at the belly, rolling, laying down. If you do have an overload of parasites, they will colic on that too. So you want to do fecal checks. You don't want to give ivermectin. And so it will tell you to get the high track. I should always have high track in your barn. If you don't have high track, then what you want to do is you want to at least have apple cider vinegar at hand right here. Do apple cider vinegar. It says 20 cc's, but I've changed it to 30 cc's and 1 tablespoon of cayenne pepper, syringe in mouth till relief. Every 15 minutes until you see poop. Okay, and then it talks about a testimonial, and it shows that it absolutely works. So Nox vomica is good, and this horse colicked all the time on this particular gal. And so I did want to tell you that this morning I got a call and an email message saying that they wanted to her horse was down. He's 26 years old. She's not on my program, and the horse was laying down, but now the horse is up because she gave it the apple cider vinegar mixed with a tablespoon of cayenne pepper. So I told her to give it to a couple times a day. She said the horse was still not eating, but it's breathing better. So it works. I'm telling you, it saves so many horses' lives. But get this free by visiting my site, happynaturalhorse.com. It's yours for free. And help your horse get through this. And to prevent it, you have to at least give my natural equine feeding program, which is located on my site, happynaturalhorse.com. Okay, hope that helps. Share this video, subscribe to my channel. Have a great day. Bye.